Christina, and I'm doing sickle cell disease. It is a group of disorders where the red blood cells are, like the normal red blood cells, lose their shape, and it kind of creates a crescent shape. The symptoms are pain is in your joints, like your elbows and your knees, and it's also in your chest. Your whole body, you feel dizzy, and you have fatigue most of the time or all the time. And you have shortness of breath because of the lack of blood flow throughout your body, and you have yellow skin or eyes. Prognosis is life expectancy is about 50 years. It could be less than that, and it could be more than that. The lack of oxygen, because yet again, you don't have enough blood flow, and then that would cause hospitalization because they would have to monitor you and make sure that you're breathing correctly. And then children, like this kid, will be likely to get infections. And my life would be different because I wouldn't live past 50 years, not much after if lived to 50 years. And I would never feel the best, and I would always have to be in and out of the hospital too. And as a child, I would have probably got a lot of infections. The treatment, it can't be cured, but it can be helped by pills like morphine and folic acid, and blood transfusions can help too, where the caregiver gives the blood bag through an IV and tries to get rid of the sickle cell blood cells and give more normal red blood cells. Blood marrow transplants can help too because they take the damaged bone marrow and replace it with the new bone marrow stem cells too. The occurrence is 1 out of every 365 African American births, they will be affected, and then 1 out of every 16,300 Hispanic American births, they will be infected, and then 1 in 13 African American babies will be born with the trait. And then it's most likely to happen between age 0 when you're born to age 3 when you're starting to develop. So both of your parents are unaffected and they are a carrier of the trait. And they have 4 kids. 1 of their kids will be affected by the disease. The mutation, it happens on the 11th chromosome, and the hemoglobin molecules don't form properly, so then your blood cells don't form properly either, and it causes the cells to get stuck in the bloodstream, and it happens if both parents have the disease. And the Punnett square is the key sickle cell disease. Big A is unaffected, little a is sickle cell. So the mom's big A, little a, and then times little a, which is the father. And I did the Punnett square, and the genotype is big A, little a is 50%, and little a is 50%, and phenotype is 50% is unaffected and 50% is sickle cell, so that child would have a 50% chance of getting the disease or have the trait. And then citations.